Good morning to all of you. Thank you, Dr. Bullock, for your welcome and for handling all the important logistical details for today's program. As Dr. Bullock mentioned, I'm Jane Kirschling, Dean of the University of Maryland School of Nursing. It is my honor to serve as co-chair of the Maryland Action Coalition together with my colleague, Dr. Patricia Travis, Associate Director of Clinical Trials at the Johns Hopkins School of Medicine. On behalf of both of us, a very warm welcome to all of you who have joined us for the annual Maryland Action Coalition Leadership Summit. I am delighted to say that due to the virtual nature of our session this year, we have about 300 registrants representing individuals from 10 states. Today's program is going to be exciting, informative, and very timely. I want to begin by thanking the members of the Planning Committee who are pictured here, in addition to Dr. Travis and myself. The committee includes Dr. Lynn Marie Bullock, Dr. Marietta Mills, Dr. Rebecca Wiseman, Jordana Signeri, Anjali Sanyar, Sonia Smith, and Stephanie White. Thank you for all your hard work in making today's summit possible. I want to begin by expressing appreciation to two individuals. First, Dr. Peggy Daw of the Maryland Higher Education Commission, who serves as the program administrator for the Nurse Support Program 2. This program is funded by the Maryland Health Services Cost Review Commission and administered by the Maryland Higher Education Commission. This unique competitive institutional grant program has provided millions of dollars for statewide initiatives to address Maryland's nursing workforce needs and to increase opportunities for academic and clinical practice nurses to work together to address healthcare issues. Later today, our live poster session, as well as our web-only poster session, will provide an opportunity to disseminate results from recent NSP2 funded projects and learn firsthand about work going on throughout the state. As always, Dr. Daw, we are grateful for your many efforts in support of nursing. Thank you very much. I also want to acknowledge the support of the Maryland Nursing Workforce Center, directed by Dr. Rebecca Wiseman, who also serves as chair of the University of Maryland School of Nursing program at the universities at Shady Grove. The Maryland Nursing Workforce Center has generously helped to defray expenses for this meeting, making it possible for us to offer this program without a registration fee. The center exemplifies the type of initiative launched through funding from the NSP2 grant program. Established in 2018, the Maryland Nursing Workforce Center collects, analyzes, and reports on the state's nursing workforce, helping us all understand the current and future demand for nursing personnel and the resources required to meet these needs. The center is also one of 36 statewide organizations that are members of the National Forum of State Nursing Workforce Centers, which provides an important locus for nursing workforce data and related issues. So thank you, Dr. Wiseman, for your leadership of the center and the center's support of today's program. I want to provide some context for today's summit by taking a step back and reminding us all of our recent history. The Maryland Action Coalition was formed in 2010 following the release of the Institute of Medicine's report on the future of nursing, leading change, advancing health. That report outlined a series of challenges for the nursing profession with a focus on preparing the nursing workforce to meet the demands of providing care to an increasingly diverse and aging population at a time of change and growing complexity in the healthcare system. Our Maryland Action Coalition is a part of the Future of Nursing Campaign for Action, an initiative of the Robert Wood Johnson Foundation and the AARP to implement the recommendations of that 2010 report through coalitions in each of the 50 states and the District of Columbia. Here in Maryland, our efforts over a decade have been enormously successful. We have expanded the number and percentage of baccalaureate educated nurses in our state and significantly increased the number of doctorally prepared nurses, two key components of the 2010 recommendations. In addition, with the establishment of the Maryland Nursing Workforce Center, we are now addressing the need for better workforce data, another key recommendation. And we've also increased the diversity of nursing at the student and faculty levels. And Maryland has been successful in reducing the barriers to practice for advanced practice nurses. Maryland is one of 23 states, plus the District of Columbia, in which state practice and licensure laws now permit nurse practitioners to practice to the full extent of their education and training, again, in keeping with the recommendations in the 2010 report. 16 states still require supervision, delegation, or team management by another health provider in order for a nurse practitioner to provide patient care. These are just a few examples of how much we've accomplished in Maryland since 2010. Later today, we'll hear from Dr. Susan Hessmiller on the latest report, just released from the National Academies of Science, Engineering, and Medicine, entitled The Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity. She will share with us the key themes and findings, including the need to reduce health disparities, address inequities in our current health system, and tackle issues of structural racism. Of course, these are not new challenges, but for many of us, they have been brought into sharper focus and given greater urgency as a result of the clearly disparate impact of COVID-19 pandemic on certain populations and the ongoing discussions of the impact of structural racism following the events of last spring. One of the outcomes of the COVID-19 pandemic has been the incredible toll that has been taken on nurses throughout the country. Many of us are learning more about the level of moral distress experienced by nurses on the front lines of care delivery. New thinking is emerging on how we can better and more fully support nursing at all levels. This will also be explored by Dr. Hessmiller during her remarks. To help us to prepare to address the challenges of charting a path to achieve health equity, we will have the opportunity to hear from Dr. Brian Castorucci on the skills and perspectives that nurses need to lead a post-pandemic public health renaissance. And to help us better understand the changing nature of the healthcare system in Maryland, Katie Wunderlich, Executive Director of the Health Services Cost Review Commission, will provide an overview on how Maryland's hospital payment system is evolving and the implications of this for a better integrated system that fosters health improvement consistent with the goals of population health. In the afternoon, as I indicated, we have the opportunity during the poster sessions to learn from our colleagues about projects and efforts that are the building blocks of an improved health infrastructure and help address the goal of better care and better health for all those we serve. So in summary, we've come an amazing distance in the past 11 years, but as so often seems to be the case, we cannot rest on these accomplishments. Even more complex and difficult issues have emerged, and these will require renewed effort and innovative strategies. But I am confident that given our track record of successes over the last decade, as well as the collaborative and collegial relationships that we have formed, Maryland's nurses can successfully address even those more daunting challenges. So thank you for being a part of today's Leadership Summit, particularly at this important time as we reimagine and reshape nursing's role. Today, we began determining how we can lead the changes needed to ensure that the patients, families, and communities that we all ultimately serve have access to the quality and caliber of healthcare that they truly need and deserve. So thank you for being a part of today's session as we begin this most important chapter of our work.